Welcome to Healing with Heart. Simple ideas for profound healing. These videos are meant for informational purposes only, not intended to diagnose or treat medical conditions.
Hey guys, Dr. Martin Hart here. Today I want to talk about hidden infections in your face, the teeth. So a lot of my patients know that we go over their dental health and their teeth a little bit in the beginning when I take their first history. Why is that? Well, in biological medicine, we know that each tooth is on a circuit, right? It's connected to an organ, a muscle, a gland, a meridian. It's almost like a circuit breaker. So if there's a problem in that tooth, it could shut down the whole circuit. Now, what are some of the different problems that are there? There's amalgam fillings, creating mercury toxicity. Every time you bite down, you're leaching heavy metals into the body. There's infections like abscesses, cavitations, infected old crowns, infected dental materials. Even underneath old fillings, a lot of times there's infections that are harboring, right? There's cavities, which are another form of infection mixed with different nutritional deficiencies. All those aspects are constantly leaking toxins and infections into our lymphatic systems, into the surrounding tissues. And once they're in that lymphatic system, they're going to get circulated around, right? So constant source of stressor in the body is the dental system. We need to make sure that there's not, for instance, one of your back molars or wisdom teeth. If there's an issue in that, it's going to impact your central nervous system and your colon. So for instance, I've had patients who've had old root canals that developed ulcerative colitis. That root canal had an infection and weakened that colon circuit, and eventually it manifested into other aspects, right? Or I've had MS patients who had infections like leftover cavitations in that old wisdom tooth that wasn't removed properly. And then all of a sudden, now they've got neurological issues that manifest, right? So I'm not saying it's a one-to-one. Just because you have a root canal in those teeth or you have an infection in a tooth like related to your sinus doesn't mean you're necessarily going to have an issue in that circuit, but it does seem to contribute in biological medicine. We do see that correlation. And so we want to take that burden off the body by finding ways to help support the body in dealing with that. So number one, you want to find a good qualified biological dentist, right? They can go through, and the holistic dentist can do different scans, CT scans, or other different biofeedback scans to see, are there infections in this tooth that we need to deal with? And then from there, they have tons of options. There's ozone, there's different laser treatments, there's different types of oral surgery, right? From my perspective with my patients, sometimes I'll make them an oral rinse to help with things like supporting the dental health, right? And supporting the immune system in the mouth. So we might make a custom blend rinse of silver and different essential oils or different resins that are helpful. I might make a mineral blend they need, right? So if you're short on calcium, vitamin D, phosphorus, K2, those are all going to make a huge impact. Another thing I might have patients do is rinse with baking soda after they brush, because that alkaline environment in your mouth helps to deactivate the bacteria and activate dentin inside the tooth so the tooth can heal itself from the inside out. And of course, I want you brushing with a fluoride-free heavy mineral toothpaste, right? I want you to make sure you're flossing after meals. Using a water pick is a great option, okay? Really supporting that dental microbiome. I've had some patients do some probiotic rinses before as well, if that seems to be a factor. And so I heavily recommend that if you've got chronic infections, that you make sure you checking your dental area, taking care of your teeth, supporting your dental health, so you can support your whole body. In the comments below, put the habits and the routines that you do to keep your mouth healthy. If you've had an experience with a dental infection, put it down there so people can understand it. And then share this if you find it useful. Take care.